Hello, veterinary clinic.
I don't know if I was speaking to you the other day about my cat going missing over a week ago.
Oh, okay.
Well, he came back at 3 o'clock this morning.
Okay, did not the wee monkey.
I think he's injured.
Okay, so we'll have a look at him for you.
In the east of Northern Ireland, rising up from the Irish Sea, lies the ancient kingdom of Mourne.
Beautiful, lovely, sun's shining, everybody's happy.
And at the heart of this community are its vets.
No, have you got a sore leg? Oh, I have a very sore leg.
We've got the head there, the body there. That's a good, healthy pregnancy.
They work tirelessly around the clock.
We've a living bull cab. That's what we're looking for.
Treating animals of all shapes and sizes.
They are cute, aren't they?
Go! Yes!
I need to rock him back and forward and talk to him gently.
Hello.
We treat every patient as an individual. Dog, cat, or cow, we care.
They face difficult decisions every day.
I can't get it to move. And I'm worried about ripping it. I'm scared of losing him. He's my wee friend.
Working hard to save lives.
We had a 50-50 chance, but unfortunately, didn't make it. Puppy!
But the rewards are worth it.
Like a wee set of bagpipes. This is one of the best parts of the job.
It's the life of a mountain vet. It's March, and the coldest start to spring in years. Across the moorns, only the hardiest are out. Cows and ewes wait to give birth, and for miles, vets brace themselves for their busiest season, delivering new life into the world.
Come on, this way here. Good doggies.
East of the mountains, in Downpatrick's oldest practice,
Morning.
the vets are starting their day.
How's the impatience this morning? Oh dear, it's really bad, isn't it?
In spring, they see over 300 animals a week. Small and large.
You get all sorts in here. You'll get the farmer in his welly boots.
Good girl.
And you'll get the lady with the dog in the handbag.
Overseeing his 4 vets and 4 nurses is Maurice King.
Morning.
He set up this practice 42 years ago.
How's my cat doing?
Starting to put weight on his back leg now.
Excellent.
We are like a family and we all work well as a team.
And you have to like the people you work with because you're with them all the time.
How long has it been like that for?
Just since last night.
Last night. All right.
That's brilliant. Right, see you in half an hour then.
In one of the morning calls, Maurice has got word of an extraordinary birth.
I don't know what the odds are, but I would imagine they're astronomical. I will look it up. I'll Google it later, but I think I've never heard of it, ever. So, the proof of the pudding will be in the eating, and we'll go out and have a look. I've been a vet for over 40 years and never seen or heard tell of it. I mean, I'm never going to see this again in my lifetime.
Maurice has spent all his working life in and around the moorns.
I'm one of 13 children, and most of them actually are still about locally, so it gives you a feeling that you're connected with the country, you know. You see the little round tower up on the top of the hill, that's the remnants of a windmill. At my age now, a lot of my original clients would be similar age, so we're dealing more and more with their children and sometimes even their grandchildren. So we're going over to see one of my favourite farmers.
The Flemings are cattle farmers in Ballyknoe, a hamlet just a few miles from the practice.
Hello. How are you? I'm wonderful. I can't believe this. You sure you didn't go and buy 2 calves, did he?
No.
You just popped them out.
Just pop them out.
That's brilliant. Hello, John. I still don't believe it. I'll believe it when I see it. You didn't buy these now?
No, did not.
I think he's winding us up, so he is. It must be near 1,000,000 to 1.
Just a few hours ago, one of the Flemings' cows gave birth.
Eeny, meeny, miny, mo.
To quadruplets.
I have been a vet since 1975 and I have never seen 4 calves born dead or alive. You're a bit small, aren't you?
They're all smaller than normal, and because calves tend to get hypothermia, John's found jackets to keep them snug.
Okay, we try and get the 4 of them up.
You must have wee tight tendons or something, this one.
Oh yeah, you see, the tendons are a wee bit contracted there.
What?
Looks like it's forward on his toes.
I think it's one.
This one here. What about that one? Legs should be like this.
The surest sign of a strong newborn is standing
Look at this.
and feeding.
That's a good sign.
All 4 have passed the physical,
That's excellent.
so Maurice turns his attention to their mother
Okay.
and quickly discovers a problem.
She's retained the placenta, so we want to try and shift this if we can. You find with twins especially, they'll retain 1 placenta. So with quadruplets, you're going to 4 times the problem. That's starting to decay inside her, and she will get septicemia from it. If we don't lose this within a few days, we could be in trouble, you know.
Carrying so many calves brings another risk too.
She doesn't have too much milk. You can see her ribs there. She's lost a lot of weight producing 4 calves. She has to make that up.
She'll need all the energy she can get to keep the milk coming for 4.
That was brilliant. I was coming when Jim was a youngster. Now, that's not Jim, that's Jim there. And he tells me that I delivered triplets on his father's farm in Dungannon. 40 years ago?
40 years ago.
40 years ago. Right, bye. Right, we couldn't shift that placenta, so we'll be back tomorrow. But they're looking very well, aren't they? The only quadruple calves in the north of Ireland, and possibly the British Isles.
Well, is that downstairs?
Yeah, it's our emergency number.
Hello, I have a wee pup here and he's just fell down the stairs.
Do you want to bring him in?
I have a wee calf here. I think he's just got too much to eat.
Can he stand, can he?
He's just lying out here now at the minute, sort of a sore valley.
Is he floated dangerously, like a balloon?
He's heading that way.
Sure, I'll come out now and we'll get a look at it.
In Downpatrick, there are 3 clinics a day. Morning, afternoon and evening.
Hello, handsome boy. Wait, let me have a look at you. Hey, don't be cross now.
You're gorgeous. So that's Sky done.
Maurice's youngest vet, Miriam Campbell, is giving 6 Staffordshire Bull pups their first jabs.
A lot of people say to us, oh, you just cuddle puppies for your job, and we say no. So on a day like this, we take full advantage of it. Who's next? Marshall.
Miriam became part of Maurice's team when she qualified 3 years ago.
You're gorgeous. We check that their eyelids are turned the correct way. We look in their mouths to make sure they don't have any cleft palate issues. We check their heart. We also check where they were attached to their mummy. Sometimes they have a little, what's called a hernia there. And then we also check with the male dogs that both of the testicles have descended. They're very good.
They're not like that in the house. They're actually a bit crazy when they're in the house.
So that's Marshall done. Guys, you're queuing up. Who's next?
Oh,
Oh, it's sore. Oh, no.
Come on.
Another wee boy.
At the end of the shift, Maurice checks on the next day's patients.
We have a dog coming in tomorrow morning, Finn. He's having bother with swallowing and with his teeth, and he seems to be in a lot of pain. I'm just looking at his history here now. He does have a heart condition, and he's 10-year-old. It quite possibly is his teeth that's giving him bother. We'll not be any more pessimistic than that, so we'll see you in the morning. Right.
On the coast, at the edge of the mountains, the appointment can't come soon enough for West Highland Terrier Finn or owner Paula.
So this is Finn's favourite spot. He sits here most of the day when he's not snoozing or going for a walk, and he people watches. He ponders on life, and he's usually so happy. He smiles at us, literally. When we come in, he smiles. See, he's drooling a bit. Doesn't usually do that. But he has been depressed. Just down. Come on, Finn. That's that boy, come on. That's that boy. We noticed his breath was getting a wee bit bad, and 3 days ago we touched him on the mouth and he howled. So we knew that there was something wrong. So he's going tomorrow for an operation. There's always a risk, and I have had a friend who has lost a pet under anaesthetic. So because Finn is that little bit older, at 10 years of age, you do worry because he's part of the family. What do you think, Finn?
What am I going to next? Am I going to this goat next?
Out on the road answering emergencies is Rachel Frew.
Yeah. Where is the goat?
She joined Maurice's team 6 years ago and is his most experienced vet.
I head out to Clinchy.
Right. Okay, no, that'll do. Cheers.
Okay,
Thank you.
Bye.
Bye, bye, bye.
Rachel spends 30 hours a week on the road, often seeing animals in trouble.
So we're going to a goat that has been attacked by a donkey now. Usually if there's been an animal attack like that, there's usually quite a lot of damage done on the inside of them. So the chances are it's probably not going to live. Animals aren't just dangerous to us, they're dangerous to each other. And it could be due to loads of different reasons, like food, or when there's like territory involved, or males can be quite aggressive due to testosterone. Sometimes you just find that you have an animal that does not like other animals, and it is a behavioural problem for them that they can't be put in with other animals because they will attack them.
Rachel's interest in animals began on her parents' beef farm.
When I was like 4, I was watching the first cesarean on a cow, and I told my dad that I was going to be a vet, that I was going to do that when I grew up. And I think this is maybe where I want to go here.
Waiting for Rachel is smallholder Jennifer, who keeps dogs, goats and ponies on the edge of Strangford Lough, east of the Mourns.
Is he up? No. We'll see what he's like. Oh, you're a wee pygmy as well. Oh, wee man. What time does this happen at? He's not been up at all.
The aggressor is rescue donkey Dennis. A year ago, he was found thin and alone in a cattle trailer. Jennifer gave him a home and kept him with her goats for company.
I mean, the problem is I can't tell how much damage there is inside, but looking at him, if you give him painkillers, he's still going to be lying there suffering. I would almost rather put him down, and then you know that he's not.
I mean, I knew as soon as I brought him up this morning. I just want him out of field.
Yeah, no, that's not a problem. Okay, I'll go get my injection here.
The donkey had him pinned on the ground. He was picking him up and throwing him about, and I managed to get him away from him, and this is the result.
And this isn't Dennis's only victim. 2 weeks ago, Jennifer found her other pygmy goat, lifeless in their field.
He's a small donkey, but he's a tiny wee goat. Oh, I think he's near enough gone.
Is he?
Mm-hmm.
Want to have I? I'm probably going to have to go into his heart just. That's all. It's just because his blood pressure's going to be low. Oh, I'm sorry, Pet. I wonder if I can maybe get a vein on you. Your wee heart is gone. Wee man. He's not feeling anything anymore there, like the... He's gone. Sorry, we couldn't have got here any sooner to put him out of his misery.
I just knew.
It's just crap, like.
It is just crap. Absolutely. I have the donkey booked to be castrated.
Yeah, definitely make sure and get that done.
He's
Just be
got too
careful of
much testosterone in him now.
Yeah. Right, we'll head on then.
Okay.
Okay.
Thank you.
The goat pretty much died when I arrived. So don't charge her for that, because like I couldn't even, like there was no blood pressure, I couldn't jag it, like I didn't give it anything, so I just went out. Don't charge it.
You just want it off.
Just take it off completely, don't charge her anything for it.
Okay.
Bye, bye, bye. You go through runs where everything that you go out to see gets better, and then you go through runs where everything you look at does not get better. Well, there's nothing you can do for it. It's just, you know, it's just rubbish. You're only ever as good as your last case. Like, people tell you the best vet in the world, and then the next thing you go out and somebody say he dies, and you're the worst vet in the world. But you can't save everything. I find that quite tough. But I don't know what else I would do. I wanted to be an astronaut when I was 13. So I might be an astronaut yet.
No, have you got a sore leg? Have you got a sore leg, have you? Oh, I have a very sore leg, don't I?
You're a good boy, aren't you? You're happy enough there, aren't you, wee man? Yeah.
Morning clinic underway.
Beautiful, lovely.
Maurice heads back out to the Miracle Quads in Ballyknoe.
It's still too cold to have the cattle outside. The only things that'll be out in the field this time of year will be the sheep and lambs. But there's no wind, sun's shining, everybody's happy.
It's been 24 hours since the calves arrived, and Maurice's main concern is their mother.
If the placenta stays in them too long, it will start to decay, and obviously bacteria will thrive in there, which could be fatal for the cow. That's basically our main worry at the minute. Is the dog welcoming us again? Hello, Jim. That's a better day. Right, John.
Right,
we'll have another look. Our cow looks brighter. Her eye is fuller, so she must be taking enough water.
She emptied half a tub last night.
Excellent.
And that was filled up, so she's about a tub in her.
Right, right. Well, we'll slip her up here, John, just to see what this placenta's like. Good, good. What's your calf? What's your calf? Come on.
But one of the quads is determined to follow the milk.
Come on. Oh. If she stands in one of those calves, she would kill her. She would fracture the ribs, you know. They're so fragile. She's an awful lot brighter than she was yesterday. Yesterday, she didn't care, but she's now much quicker on her feet. Lovely job. Good man, good man, good man. Okay, we've got her secure now, so we're safe. And more importantly, the calves are safe. Look at her there now, she's much fuller there than she was yesterday. She bulks up with me, she will eat that silage.
Now the problem placenta.
It's definitely coming.
Maurice feels to see if it's detaching in one piece.
The placenta is out. But it can tear sometimes and leave some inside. That's all we got. Okay. Happy days, John.
Next, the quad that was wobbly on its feet.
Yep. Definitely going a bit better, Maurice.
He's standing much straighter now. Yesterday was more like that there. He wasn't controlling it at all. He's damaged the ligaments in the knee joint. But he doesn't have to run any races, so he'll be fine. Every day is improving, so he is.
Before Maurice heads off, one last job. To help the calf's mother keep up the milk supply, a glucose and vitamin drink.
John, you're not holding her at all.
And you're not putting it on her. And you're supposed to be the vet.
That's half it. The cow's doing well. I'm glad to see her filled up.
Good management on the farm.
Good management on the farm, good farm management. Excellent veterinary surgeon. Good quality feed. You smell that? It's sweet, you could eat it yourself.
It's good to see her appetite back up. I was a bit worried. It's an awful lot of work trying to keep the four of them going.
So I'd be very confident they'll all live, and the cow herself is fine.
The quads will stay warm inside until the better spring weather arrives.
Happy days.
Hello?
Hello. I have you for one lamb bedding.
Okay.
I can bring her into the surgery.
Sure you do that then.
Okay.
Okay.
All right.
Bye-bye.
Hello, how are you? My Labrador had surgery this morning. Yeah, so Samson's still sleepy, but a toe actually needed to come off. The whole toe? Yeah, it's been removed. That's okay. Not a bother. Okay, thank you. Bye-bye.
At the clinic, it's lunch break for the vets, their pets and the clinic cat.
You all right, Jim? Jimbo, for some reason, loves melon. It has to be fresh for him, obviously. Hey, Papa, do you want some tea? He's so weird. Come on.
But one dog skipping the snacks is Finn, just arriving for an investigation under general anaesthetic.
You've been starved since last night? Yes, I have. Probably not too happy about that. We'll give you a wee ring then this afternoon when it's all done. It's all right. All right, pet.
Right. No, Finn wasn't happy a couple of days ago with his mouth. He wasn't eating. He was salivating an awful lot. So we're just going to sedate him now and have a look. He resented you around there, you see there? Just the back of his throat. So I'm a wee bit concerned about that area. Now, this is the sedation. There we go.
Good boy, Finn. Oh, it stings.
That takes a few minutes to take effect and then we shall take him on through.
Right, we'll get you settled in.
Finn joins his fellow patients, all awaiting their turn on the vet's table.
He's very easygoing. He's very placid, my dog.
Right, I'm going to go ahead and do him then. He's ready to go.
Today, Maurice is assisted by Nurse Hazel and his newest vet, 25-year-old Daisy Dillon.
This is an ET tube. When you're asleep or anaesthetised, the idea is to protect your airway, ensure you have a flow of air and obviously anaesthetic gas.
Daisy qualified just 8 months ago.
This is my first job as a vet. We really get on really well. It keeps you from being more nervous than you need to be. That's nice.
So, he's fully anaesthetised now, so we're just going to have a look round here.
First, Maurice checks to see if there are any worrying lumps in Finn's throat.
There's no problems with growths there. That's where you get a problem. Nothing here at all.
It's good news. The next possibility for a Westie especially is tooth decay.
Now, this one here, there's a fair bit of movement in it. Dental conditions tend to occur in elderly dogs by the nature of things. A couple incisors are quite loose too. They'll probably have to be extracted. Right?
For now, Finn has all 42 teeth an adult West Highland Terrier should.
Just gentle traction.
But not for long.
One behind it is a similar condition.
The second molar comes out easily.
Now let's just check the rest.
Westies have 6 lower incisors to help them cut through meat.
So?
But one needs to come out. Like that too. Actually, 3. Finn will come round to half the lower incisors he arrived with.
So that's us finished with extractions.
And in all, 5 fewer teeth.
So, all good news as far as Finn's concerned. So he'll have a lovely smile apart from these incisors that some cruel vet actually took out of him. Right.
Oh my goodness. Oh, they're very bad, aren't they? I must have been in pain with those.
Yeah.
Yeah.
I take it you don't want to take them home with you?
No,
Okay.
no, you can keep those. No.
We'll get the dog for you then.
Yes, please.
No. But you're a good little dog. There's somebody here to see you. Now here we
Hello,
are.
wee man. Hello. Okay, Finn.
There you go.
Oh, he's fell out with me. Hello, Finn. How'd you get on, pet? Oh, looks like he's not talking to me. Finn.
He'll be grand.
Yeah. Thank you very much.
Within days, Finn is back on form, enjoying his sea view.
Finn, what are you barking at? What's all that barking about? What's all that noise? Who's out there? He's just so much better. Sitting on a spot in the window, barking, wagging his tail, people watching. Good boy. He's enjoying his food again, so he is. And he gets his teeth brushed as well. Don't you, Finn? Well, yeah, it's great to see him on top form.
The moorns stretch across County Down, where there are more horse breeders than in the rest of Northern Ireland put together. Some of the best horses in Ireland were foaled in sight of the mountains, and caring for many of them is Tullyrain Equine Clinic, where 4 vets,
So we've inflated the stomach now.
3 clinic assistants, and 2 stable hands specialise in sports medicine for thoroughbreds.
Good girl, well done.
And donkeys. On the operating table today is Dangerous Dennis.
So today we are castrating this older donkey because he has been showing very aggressive behavior towards other animals. And so the owner has decided to get him castrated, which will hopefully settle him down a little bit. Good boy. This is just sedation.
Helping Dennis with his rehabilitation is specialist surgeon Inge de Haas.
Sam, stand on the other side of him.
Inge trained at home in Belgium before joining Tullyrain 17 years ago.
He's really fighting everything. Okay, just let him stand there for a wee second. He's not small and sweet, but his head is starting to go droopy. He's breathing a bit heavier. And then our next step is to give him ketamine to anaesthetize him so that we can then put him on the table and castrate him. He's just a wee fighter. Okay. Be careful with his back legs because he can still kick.
Castration will reduce the testosterone swirling in Dennis's system and hopefully his temper.
So we're now going to lift him onto the table. We can clean him up nicely and sterilise the area that we're going to do the surgery on. Just have him that he lies, that I can get at him. Okay, stable enough? He's very, very dirty. So Dennis is 8 years old. He's an older donkey. So the risks of the operations are higher than it would be if it was a young donkey. So we're going to do a closed castration, which means we're going to tie off the cord as well as the blood vessels to prevent any bleeding or any post-surgical complications. What we're going to do is just go through the skin and the subcutaneous tissue. So We're just pulling up this sack, which is this, and then we're going to put the emasculators over the cord, and it crushes and cuts. So, like this. That's the first testicle. He will be blissfully unaware until after the deed is done.
But sacrificing Dennis's testicles isn't any guarantee of a sweeter disposition.
It's important for the owner to know that despite putting him through the castration, it may not necessarily mean that he will change behaviour. It may be that his testosterone levels make him aggressive, but it could also be that it has become a habit for him, that he just does not like other animals. You can prevent this behaviour starting if you do them early on, but of course this was not an option in this donkey because the lady rescued him when he was already 7 years old. It's not really the donkey's fault. He has been mistreated in his previous life. And not really had a chance to be a nice donkey to other animals, so maybe this will change.
After a few days of observation at Tullyrain, Dennis will go home to Jennifer, hopefully a more social animal.
I have a calf, it's not well. Right. It's a bit off colour. Run it into the surgery then. Right, I'll do it. Okay, thanks, nice.
We have a cabin here, just like the out.
Is it big?
Just see the feet, you know.
All right, see you shortly.
Quiet!
So, what do I need? That, that, that. Okay.
A few weeks into the birthing season, and another new life has entered the world.
We were going out to look at a mare and foal. This mare has foaled during the night. The first day is critical. If the foal has got up, it's a good sign. It obviously hasn't suffered any trauma. If the foal is up and sucking, I think we'd be happy.
In the shadow of the Mourns, in a stable overlooking the Tullymore forest, a mare called Spring has delivered her first foal. To her owner's amazement.
Right, Sabine, she foaled during the night?
Yes, yes.
Totally unexpected?
Totally unexpected. We did think that the mare was looking, well, we thought she was fat and we thought it was just too much good grass.
But the point of it is that there are no stallions here. We don't have any stallions anywhere, do we?
Not that I know of.
Not that I know of either. No. So this is what we call the Immaculate Conception. The miracle of Tullery.
Arriving on the heels of the quadruplets, it's a magical start to the season.
And he has not risen yet.
Not as far as I know.
Okay, we shall see. Come on, son.
First, Maurice sees if the foal has the strength to stand.
He doesn't appear to have much power in his back end.
It's not a promising sign.
We have a little filly. Filly, yeah. We'll let her down again, yeah. We just have to check the mirror. We're just checking that she has milk.
First-time mothers often don't produce much milk.
She does have milk, but she's quite tense here, so I don't think the foal is sucked. The foal hasn't got to his feet yet. It hasn't suckled, which is worrying.
Sabine doesn't know when the foal was born, but there's a short window of time to get her feeding, or her chances of survival will plummet.
The first milk contains a lot of antibodies, which protects the foal against diseases. And it's essentially gets it quite quickly. If you don't get colostrum in the first 8-10 hours of life, it doesn't matter how much colostrum you put in, the foal will not have antibodies. It will then succumb to pneumonia, enteritis, and die.
Every minute counts, and Maurice races away for a milk substitute.
I'm still in complete shock about this baby, and I really am very anxious that she get up and suck. I'm just gonna have to make an effort, won't you? Good girl. Yeah. Come on.
Maurice is back with the formula milk and has brought Daisy to help.
This is artificial colostrum to give the foal enough strength, hopefully, to stand and suck on his own.
Oh, wee Bobby. You're a big leggy brute, aren't you?
Maurice tries to milk Spring. Only the real stuff has all the antibodies her foal urgently needs.
Okay. Sabine, could you hold his back end up, please?
Mixing a few hundred millilitres of Spring's milk with formula, Maurice takes no chances and feeds the foal directly into her stomach.
Excellent.
Come on. He's gonna lie down.
All good. Give him a rest there.
Aye, that's quite good if he stays up, that's fine.
That's a good feed. Okay. We'll just play it by ear. We'll come back, give more.
When?
This afternoon.
We'll see if we can get him to suck later first. Maurice.
Yeah. Hopefully that will give him a bit of strength.
Yeah.
Okay. We're hoping in a couple of hours the foal may be able to suck. My only concern is it's still quite weak and unable to stand. So we'll keep our fingers crossed.
Papa Ridge. He shouldn't be too far away, hopefully. Tea's made, so we're ready to go.
In Downpatrick, the team is gathering for a surprise.
Oh, here he's coming. Right, we'll get the candles lit. Hey, Poppy, we're having a party today, aren't you? Lucky.
Were you saying happy birthday?
Yeah.
Okay.
It's Maurice's 67th birthday.
Happy birthday to you.
Is there explosions?
Happy birthday, dear Maurice. Happy birthday to you. Woo! Hooray!
Oh, you're wonderful, truly wonderful.
Thank you. I think that was a good reaction.
I didn't expect the explosions, my God.
Oh, did we scare you? Think you were...
Sorry.
Shut up.
So how was the foal in the end?
Sabina claims this mare got in foal without a stallion.
Oh my goodness. So how did that happen?
But we'll figure that out.
Unbelievable.
What about wearing Marsha's cap, Poppy? What do you think? Here's perfect. Was Granda hard on you there? Was he? Oh, okay. Well, happy birthday.
Thank you very much.
Sabine has barely left the foal's side since discovering her in the morning.
I've been here trying to encourage the baby to get up, and I'm concerned because normally they should be up within 2 hours of birth and drinking. So it's been almost the whole day and the milk is flowing. So I think Spring is ready to be a mum.
Daisy's back to see how things are progressing.
You need to move your leg, you silly horse. Just hold there.
Oh, I'm sorry, lady. Come on, you wibbly wobbly thing. Come on, you're nearly there. You're so nearly there. I think he's tired. We'll go back. You can flop on the floor for a minute or two, and I'll see if I can strip her a wee bit. Oh. So we didn't quite get it there, but we're very close.
He didn't. He got up.
As the foal isn't up and suckling, Daisy must now try her hand at milking Spring.
I've never done this before.
I'm very impressed that you can milk a horse at all.
You learn something new every day, don't you?
Hopefully a little secret will smell it and get interested.
Secret, is that the name?
Yes.
Although the identity of Secret's father may no longer be a mystery.
I was talking to a riding school teacher, and she says they had an 18-month-old in the fields. So yeah, there is a possibility that that is the culprit.
What was he then?
He's a dark bay, so would be the colouring would be about right.
Oh, bless her. What a girl. Now, how much have we got? That's not that bad, sure it's not.
No. Good girl. That's brilliant. Yeah, did we get some in?
Are you tired?
Me?
I'm sure you are too.
Yes.
I know.
Oh, baby.
Oh. Where are you going to go?
No, we're standing now. No, she says I'm not lying down. Just trying to go to the toilet.
At last, Secret finds the strength to stand.
You're fighting, that's good. Glad to see a fighter. Clever girl.
It's my favourite bit of the job, full stop, you know, helping to bring new life into the world. Whether it's a calving or a lambing or puppies or whatever, doesn't matter. What type of new life, but new life.
Oh, whatever way you want to go, baby. Oof. Good job. I'm feeling very relieved now that the baby got up and has been standing, and I love seeing the mum taking an interest as well. So I'm very hopeful now that actually things will work out.
Secret's fighting spirit is taking hold.
Sounds and wonders, endless waters flow. Let's gather all the treasure we can find.
So he's certainly sore when I'm just feeding him down here at his little fetlock joint.
The season is gathering pace and more new life is flowing through the clinic.
Just gonna check its temperature here. Anything over 39 in a lamb is really, really high. The temperature's reading 40.5. So we're gonna give him some anti-inflammatories and some pain relief. Okay.
And along with all the new arrivals,
it's something I would very rarely see nowadays.
Cahir has encountered one animal just waking up from hibernation.
Since I was a child, this is probably the first time I've seen a hedgehog really close up, but there's no doubt hedgehogs are very cute.
The hedgehog's likely to have been living off its fat reserves for 4 months.
Well, I was walking with the dogs about 4 or 5 days ago and found him on the side of the path, and he was walking along the driveway and disorientated. And I am now worried, is he actually blind because he's not behaving as a normal hedgehog would? To be honest with you, I know very little about them. I call him Harry the Hedgehog, but I honestly don't know if he's a Harry or a Henrietta.
Right, come on ahead. Hello.
A little hedgehog friend. Hello, little hedgehog. Oh, hey, yeah. Oh, yum, 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 yum. Right, we'll give him some food since he has come out to say hello. Tasty bites. Oh, no, don't be doing that. There you go. Oh, you're so hungry.
He is hungry. I've fed him about 3 times. He ate masses. He ate absolutely masses. But what I'm concerned about is when he's sort of they're walking along, he sort of walks strangely. He was like hogging the side to know that he was
almost
in contact
like he was trying
or something.
to touch it. Okay.
So I don't know if it's just because he's disorientated.
Oh no, give me the finger back. If they crawl into a ball, it means they're quite strong because they're fit enough to actually do that. That obviously involves quite a lot of energy. Now, because he's all balled up, I can't assess his eyes because they are tucked right up in. So his eyes are well hidden.
Yeah.
So they're quite prone to getting traumas to their eyes. So I need to get him to be in a normal standing position. So I need to rock him back and forward and talk to him gently to try and coax him out of his little ball. Hello. But we'll maybe just set him down for he came out there a wee minute ago. Oh, tasty bites.
For food, I think.
We'll come out for food. Can you smell some tasty bites? Yum, yum, yum. Yum, yum, yum. Oh. Hiya. Oh, he says, oh, look, tasty bites. It's okay, I'm not going to touch you. Look, here, tasty bites. We'll maybe leave a wee bit more out for you. We'll just have to continue feeding you. This is maybe his evil plan all along. Hello. Hi. You're quite a cute little hedgehog. So this is just a little bit of dye so I can have a wee look into his eyes and make sure there's no ulcers. The dye that I put into his eye, if there's an ulcer, it stains thickly green. I want to have a wee look in your paper. Tiny, tiny wee eyes. And there's no dye staining in them, so it doesn't look like there's a wee ulcer.
So he's healthy enough?
I think he can see okay, you know.
Do you know if he's a fella or a girl?
Now, let me see. Hello, my little hedgehog friend. Oh, yum, 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 yum. Oh, hello, we have bits there we can identify now, potentially. I think your hedgehog might be a boy.
It's a boy. It is a Harry. Oh, did he nip you?
Yes. I think he just mistook my finger for food. He says, this is wonderful. This is the best day of my life. Usually when we would have hedgehogs coming in, they've either been hit by a car or they've been like a severe trauma. It's very rarely that you would get like a wee healthy sort of looking hedgehog coming into you. I'd be happy with him. I mean, like he's very bright. He's very capable of curling himself up into a ball and protecting himself. He's eating us out of house and home.
Maybe, man.
He hates also feeders. She likes to feed all the animals that come in. Yes, this is clearly her favourite animal ever.
He's hoovering this.
This is like us at lunchtime. Isn't it excellent, hedgehog?
Reassured that he's in robust shape, Kerry takes Harry to his garden.
Very pleased. I was so worried that he was blind, and to know that he isn't is great. So this is an enclosed bit of garden, so fingers crossed he can just be in here. We set the little house up for him. So we'll just put him in. I'll just literally, can't be too ceremonial, I'll just have to tip him in. He's in. He seems quite happy. So he is Harry the Hedgehog, and fingers crossed all goes well and he finds Mrs. Harry soon, which would be even better. If we could have little Harrys later in the year, that would be fantastic.
Now all the world's asleep, but the leaves in the woodland, they whisper their rhymes down to the roots running so deep.
Well, good luck, Harry.
In the seaside town of Newcastle, close to Slieve Donard, the highest peak in the Mournes, Maurice's son Cahir runs their second, smaller practice.
The Newcastle clinic is a bit different to the Downpatrick clinic. Over here we mainly do companion animals and pets, with the occasional wildlife case coming down from the mountains. I suppose growing up in a veterinary family, it was an obvious choice to come back and work in the area I grew up in for the family practice. It's a nice area to work in, and Dad's an easy boss to have. Along the way we acquired Molly the Collie, who is a rescue border collie from the Mournes, who has been my constant companion. No, it's all right. This is our annual MOT. This tooth here has been snapped because Molly likes chasing everything from sticks to stones to cars to seagulls. The eyes are going a little bit blue. They're not quite as clear as they used to be. There's a possibility she was maltreated. Molly, get you? Because she was found as a straying and just very afraid of people. And it took us a long time to train her to like people. She's still a little bit nervous and a little bit cowed. 16.5 kilos. So, another year, Molly, and you're still with us. Get you? Come on. Elegant as ever.
Come on, fella.
Today, English bulldog Barkley has been dropped off by his owner for a special rendezvous.
That's the boy.
Close behind is 3-year-old bitch Boo, with owner Tiernan.
It's quite a sad story in some ways. Boo would really, really like a puppy, but she's been a little bit unlucky in love. She just hasn't found the right male, and she's not so keen on the axe for making a puppy. So what we've decided to do is artificial insemination.
The hope is that Barkley will be a willing donor.
Artificial insemination is commonly carried out in veterinary clinics across the land, across multiple species, and in this clinic we do it a few times a year. So the plan is we're going to collect a sample from a male dog and pop it into her, and hopefully in about 6 weeks' time we'll have some puppies. So fingers crossed. Hello, Boo. This is your lucky day. Right, okay. Did you have a go at the natural mating earlier? No. Do you want to give it a go?
Try it. Yeah.
We'll give him a minute, yeah. Well, Bartley.
That's right, Bartley.
Right, Let him out and see if anything happens. And if it doesn't, it doesn't. Fair enough.
English bulldogs are bred to produce short legs and stout bodies.
You know she's fertile anyway.
But the traits that win prizes also make it hard for males to mount the females to breed naturally.
Bit of courtship going on. So romantic. No, he's not, is he? Okay. Can you pop her in the cage, please? So what we're going to do is collect the semen from him, and when it's ready, we're just going to put it straight into her, so it's pretty low invasive. Gotta get the kit right. All right, Jeremy, if you hold him tight. Didn't get him excited enough. Maybe can't. Think of... I don't know what you think of when you're a bulldog. Good boy. Yeah, we're getting there. Come on, come on, come on, come on, come on, come on, come on. I don't think he's got a whole lot in him today. Come on, fella. Keep working it. Well, he's not got enough at the minute. No. I'd like a little bit more. Come on, Bartley. You can do better than that. Come on. Come on, bit more, my man. That's it. At least he's helping us out. That's funny, is it, from where you're standing? Jeez, I'm glad you're happy. I'm never going to forgive you, man. Nope, that's our sample. Good boy. If you don't mind popping her in the table, we'll pop this in quickly.
Barkley rests, and then it's Boo's turn.
Okay, and lift her up at the back end for me, please. Turn and just face her towards you. Good girl. Good girl. We're just going to gently inject our sample. There we go. A little bit will probably leak out, so we're going to lift her up by the back legs, try and keep as much in as possible. We're just going to withdraw this slowly. Thank you. You can lower her down now, that's fine.
You alright? You okay?
You're a good girl.
That's it.
Good girl. Good girl. Good girl. Good girl. I don't think it was the world's best sample we got, but we'll find out in about 6 weeks' time. That went really well. I was very pleased with it. I thought that Bartley played his part pretty admirably. He's pretty wrecked in there. Boo seemed to enjoy the experience. I mean, it wasn't going to happen naturally, this mating, so unfortunately we had to resort to artificial insemination, and it's a reasonable process to undertake if you want puppies at the end of it. So, strange that it worked, but I'm pleased. I'm pleased that we're able to help.
Look at this hazel.
In the main practice, Maurice's pictures have made the local paper.
Here's our calves.
Oh, flip the quadruplets.
Yeah.
Oh wow, look amazing, don't they? I like their wee jackets as well, they're cute, aren't they?
No more matching Sweden.
Oh, flip, that's brilliant. Oh, it couldn't happen to a nicer family, they're lovely people.
Yeah, it's great fun. That's lovely.
Very good.
We'll have
Very
to keep
good.
that as a souvenir.
Well, we'll get it framed up on the wall. That's my job this afternoon.
Yep.
10 miles away on Strangford Lough, Dennis is recuperating after his surgery.
Come on. It's all right, come on.
The hope is that he'll now be less aggressive. But for Jennifer, only time will heal the rift between them.
My relationship with Dennis went downhill very badly after he murdered my goats. I was very disappointed in him. That's where the goats lived. Dennis did that. The fence, the whole way round, he eats it. He eats it. And he's eating his stable. As you can see, there's not very much left of it. So, no more goats. When I brought him home from the vet, he came into the field looking for them and calling for them, and well, he's made himself lonely, unfortunately. He's brilliant with the children, absolutely loves them. wouldn't bite or kick or anything, but he does have that aggression towards animals, and I'm hoping that'll settle down now. You know, maybe he can have a companion at some stage in the future. Another donkey, probably. A bigger donkey.
You've got to walk that lonesome valley. You've got to walk it by yourself.
The cold weather is receding, and at last spring has come to the lowlands.
We just have to get your injections, don't we, big fella?
Oh, no, it's stinging, isn't it?
Oh, it stings.
Okay. So we're just going to send him home on a couple of days worth of antibiotics. You're quite happy with lamb, aren't you?
Yes, he's beautiful. All right, he's a good patient.
That's good.
The lamb is well enough to go home. But for other new arrivals in the Mourns, the hold on life is more tenuous.
We got a bit of bad news about our foal this morning, so we did. Unfortunately, she died about 11 o'clock. She wasn't making any progress towards being able to stand on her own. We thought we had a 50-50 chance, but unfortunately, we didn't make it.
She never actually suckled or latched on to the mare, so I was feeding her from a bottle. But the foal just was a reluctant drinker as well, and just got weak and got very, very weak this morning, and then just very quietly passed away. So it was a lovely surprise, but sad end.
At this time of year, we're sort of anticipating an influx of new life, so we are. But you got to balance that with some of those will be deaths as well. So. But normally, a bad day is balanced out by 6 good days.
Hiya. Oh my goodness, you're very bold, aren't you?
And I think if you stick at that ratio, you'll be happy.
After weeks inside, it's finally warm enough for the quads to be released into the fields of Ballyknoe.
A nice day to let them out. She looks happy, so she does. That's special. It's been a long winter for everybody, so it has.
Hello, I had a wee dog knocked down this morning here. Bad shape, is he? Get a bit of a thump around the head. Just come on your head there, I'll be here for you.